I would like to introduce now the next speaker. It's a co-author and our EWMA president, Salla Seppänen, and she will talk about holistic assessment, wound patient, and home environment.
Thank you, Sebastian. And good morning, every one of you. I also bring my warm regards from Finland, where we are at the moment struggling in the home care sector of that more and more patients are expected to be cared in home care, but there is not enough resources, and also the patients are more demanding. So I think this is maybe something we can share in quite many countries here in Europe. So my topic is about holistic assessment, wound patient, and home environment. Holism and holistic care in nursing discipline has a long history. Florence Nightingale is considered to be one of the first holistic nurses. She believed in care that focused on unity, wellness, and the interrelationship of human beings and their environment. American Holistic Nurses Association defined 1998 holistic nursing as all nursing practice that has healing the whole person as its goal. Holistic nursing is a specialty practice that draws on nursing knowledge, theories, expertise, and intuition to guide nurses in becoming therapeutic partners with people in their care. This practice recognizes the totality of the human being, the interconnectedness of body, mind, emotions, spirit, social and cultural relationships, context, and environment. Eccleton and Chalmers stress that fundamental in holism is the wholeness of human being and the balance within the person and between the person and his or her environment. Holistic approach includes the elements of the psychological, physiological, sociological, economical, spiritual dimensions, and challenges us to assess the patient as a whole and in relation to his or her living context. In a way, holism could be seen as a contrast within the modern medical model approach to health and illness, which consider the individual aspects of the patient in isolation from the living context. Even in so early than 1987, Sarkey and Scorner pointed out in their article of the analysis of the concept holism in nursing literature that holism is something all nurses should understand and something in which all should practice. Reality is that holism is not automatically present in all nursing intervention. While doing this document, I found very interesting research article concerning the holism in community leg ulcer management in Kronoberg County in Sweden and East Riding in Yorkshire and Hull in UK. It is not very new. It is published 2003 in the British Journal of Community Nursing, but I think it's a very interesting way how they have looked at what is holism. In the study was compared nurses' perception of the holistic care in primary health care and nursing home setting. The data was connected by patient scenarios and the survey for the professionals. The survey was sent in Sweden for 311 nurses and 222 completed it. And in UK, survey was sent 124 nurses and 54 responded it. The study defined 4 major categories for elements of holistic care in wound management described by nurses: the wound and patient, more than wound, toward a holistic approach to wound management, and the organizational elements of patient-centered care, and also mentioned the others. In the table on the right are presented the numbers of the statements by Swedish and UK nurses in each main categories. The results showed that Swedish nurses paid more attention to the patient's experiences of the wound, lifestyle factor, and environment than the nurses in UK. But in both countries, holistic care appeared to be lacking. Nurses focused in assessment, planning, and implementation of care on status of wound and wound healing process, and did not have holistic approach, which also take into the consideration the relationship between the patient and the environment. Patients and relatives in this study were seldom or never involved in care of chronic leg ulcers. Even the nurses say that they see participation of the patients and relatives positively. In home care context, holism is crucial. When focusing on wound care in homely settings, the holistic approach highlights the patient as a whole, not only the wound. And obviously then, the patient is in center of the care and the decision making. And also the family and the environmental factors are taken into the consideration in care. The society itself, with the economical and cultural dimensions, as well as organizational factors related to the care provider, like professionals, their knowledge and skills, as well as available material and resources, like technology, dressing, wound care products, are part of the holistic approach. The holistic care approach, assessing of the patients with wound in homely setting, focuses on the 6 key aspects: the patient's physical, psychological, social, spiritual, and economical needs, like diseases, functional capacity, attitude, fears, expectations, social networks, hobbies, daily living costs, and the need for the economical support. And to the patient's personal resources and empowerment, which are the incomes of the patient, what is the ability to be involved in the wound care. The third one is the patient's and his or her family life contexts, including all those dimensions which were mentioned earlier. But in practice it means that what is the family income, which are the daily activities inside the family, who are actually the family members, and what are their expectations, and are there the so-called wider contexts in the family, and there are other also participating to the care. And also their fears and beliefs, which is related to the wound patient's situation. The fourth one is the patient's living habits and possible risks for the wound healing and re-ulcerations. And then we come to the questions of nutrition, overweight, smoking, alcohol, drug abuses, experiences of stress, lacking of sleeping, and low physical activities, which are all risk factors for many chronic diseases. But it is also important to look at wound and peri-wound status and symptoms, the size of wound, exudating, looking at the surrounding skin of wound. That is what we are very much aware, and I believe we do this very carefully. The last one is so-called organizational factors and the efficient use of resources. And what is the professional knowledge and skills that we can question also in our own organizations and think who are the best people to be caring the wounds. And the wound care products and the technology. For example, in Finland, where we have only 5 million population, we don't have all that selection which is available in the world in the wound management products. And then also the technology. And important is that how we guarantee the continuity of the care. What is our path and models for that? Holistic approach in the assessment of the patients with wounds optimize wound healing, while it takes into the consideration all factors that influence to the care and maximizes the available resources. It prevents fragmented or inappropriate care for individual patients and contributes to focus on cost effectiveness and high quality in care. It is known that interdisciplinary working is essential for the holistic approach to chronic wound management, but implementation of it is rare in practice. Holistic patient-centered care and team approach is necessary in order to support the person with chronic wounds and to manage the complexity and variety issues that may involve in. The impact of chronic wound for family care and carers should not be underestimated, and it is important to recognize that carers and the support that they may need. It is important for the patient and the family members, and also so-called informal carers, to give a role and place for professionals in care with the respect of their sense of family. During the home care visits, the conversations about family, place, and the relations are equally as important as discussion of the progress of the wound. The shared understanding of what is important in patient's life and family members' life leads to meaningful conversations about their own approach to managing the health condition. To give a family a role, a sense of ownership and independence, professionals can promote self-care and encourage patients and family members to have significant role in decision-making and managing of the wounds. In conclusions, collaborative, holistic approach where health professionals, the patient, and family members work together can help to achieve good outcomes in care of the patients with wounds. The fact is that the implementation of holistic approach in wound care is still a challenge that need to be met, especially while caring patients with wounds in homely settings. To achieve this, more practice-oriented education is also needed for holistic care in the context of home care, wound care. So here are the references I used in this presentation beside of that home care, wound care document which is just published. So thank you for your interest.
Thank you very much.